Is it okay if I record you and share this with other people for educational purposes?
Yes, sir.
Okay, thank you. There we go. So last time I saw you was 3 days ago,
All the
and
names are changed to protect the innocent.
yeah. Have you been able to walk a few times? I know you sent me the message after, like, the next day.
I
and you said
walked.
that it was
Yes, that was what. Anyway, I walked every day. Today, I had to go to book club early, so I didn't walk. So I came home about 3 o'clock, and I did the elliptical
okay.
for 10 minutes. And then
Is that something you normally do?
No,
No?
I
Is that
don't
the
like
first? Yeah. Is that the first time you've done that in a while or ever?
No, I've done it.
In a while.
Yeah, I haven't done it in a while.
Okay.
Because I'd much rather walk outside.
How'd your walks go?
My walks were fine.
Yeah. Did they
And-
change in any way that was like significant, or is it like, still hurts the same when I go out and come back?
No, actually, yesterday was a pretty good day. I didn't hurt all that much.
Okay.
I don't know if it was the elliptical or because I was tired when I did it, but I'm not feeling too good this afternoon.
Yeah. Yeah. How were you when you woke up this morning?
When I woke up this morning, I was okay.
Okay. 0 to 10, give it a pain number. What do you think?
Well, actually, yesterday and today when I got up, it would probably be like a 1.
Good. Where were your
It was
symptoms at?
feeling good.
when
But
you were
like I
feeling-
said, something happened today.
Okay.
And I'm sore. Yeah, and it even hurts when I when I press on my back
Yeah.
here, where her grandpa's.
Did you sit for a long time today in your book club?
Can you see?
Yep. Yep.
Yeah.
So not so much the outside of the hip where that bursitis was,
Right. No,
but now it's that starting point that we had talked about before where it would wrap around.
yes.
to the
and
hip.
I
Okay.
have been doing the exercises at least 4 or 5 times a day.
Okay. Have those made you worse at all?
No, I don't think they made me worse. I think they made me better.
What about immediately after? Like, would it spike up symptoms at all?
No.
Okay. And then did you ever see a correlation between you were starting to have some symptoms and you would do the exercise and then what would happen?
It would feel better.
Okay. What about right now? Have you done the exercises since doing the elliptical?
Yes.
Okay.
Yes. I've done them twice, but it's not helping.
Okay. When did you do the elliptical? How many hours ago, you think?
It was about, let's see.
5, 6,
No, the elliptical was before we went for a walk.
5 or 6 hours ago.
Yeah.
What time is it?
8 o'clock.
Is it
Yeah,
8
about
there?
5 hours ago.
Okay. So you did
And
the
then-
elliptical first and then went on a walk?
Yeah, I didn't know I was going on a walk.
Okay.
And then about an hour after I did that, he said he was going on a walk. He wanted me to go with him. So I went.
Okay.
And I did not feel very good going on the walk. We didn't walk as far as we normally did.
Okay.
And I was feeling more sore and fatigued.
Okay. Gotcha. Just in that one spot, or was it the whole leg or both legs, or describe that?
No, it wasn't both legs. It was it was just my left leg and my back.
Okay.
And that's your sacrum.
Yeah, whatever you call that thing
Yeah.
back
That
there.
area back there. Okay.
That's what the doctor and MD Anderson said was your sacrum.
Yeah. Yeah, who knows? Well, there's also some doctors saying it was a hip bursitis, and that
Yeah.
wasn't the case. So we'll just go off of what's
Well,
actually
and he didn't say for sure. He just said probably because he x-rayed me. And
right,
he didn't
which won't
see
show.
anything. Yeah.
Nothing will show. No bursitis. That's like taking an X-ray and saying you have the flu. It's like, wait, what? How do you know? There's no way to tell. But the big point is, you did the elliptical.
Yes.
It may have flared you up. Did it flare you up during or immediately after, or were you fine afterward?
No, I wasn't fine afterwards. I was sore.
When did you start to feel that spot in your back?
When I got off.
Okay. So after that was getting you. And then how about any pain medications, anything like that?
No, I haven't taken anything.
All right.
I probably should take some Aleve now.
Yeah. Does that usually help it some?
Yeah,
Okay. Have you slept the last few days?
pretty much normal, about 6 hours a night.
Anything waking you up at night?
No, like I said, until today, I was feeling better.
Okay. Gotcha. When you went on your walks, were they still 0.8 of a mile or a mile or so?
Less.
A little bit less. I cut back to keep from irritating anything, so it was more like
Half a mile.
6. I think my phone said it was 0.6 of a mile.
Now, was that today or yesterday, day before?
Yesterday and the day before, yes.
Okay. Gotcha.
Today, I probably didn't go. I didn't go a half mile. It was like 0.4 or something.
Yeah.
Because I wasn't feeling good, so we turned around and came back before we made the full thing.
Right. So it could just be that your walking distance is decreased, and that may have helped it a little bit too. Be a little less irritable in the last couple of days. Let's do this. Let's see what that spot is doing with respect to doing some movement testing, like forward bending, backward, side to side. And then we'll do that nerve test, that nerve tension test, where you straighten out your leg and bring your toes back towards your head.
Right.
Try that stuff again. But right this second, if you had to give it a 0 to 10, what do you think you're at?
A 4.
Okay. Gotcha. Any numbness or tingling or weird stuff in your foot?
No.
Okay. Anything in that spot like the hip, the bursitis area?
No numbness or tingling, but it is sensitive when you push on it.
Okay. What about if you're not pushing on it? Are you feeling a pain if you compare the right side versus the left side? I know that's kind of a weird question because
I wouldn't call it a pain. I would call it more of an ache.
Okay. But would that be considered a 4 as well?
Yeah.
Okay. All right. So we're kind of back to if it was 3-4 days ago when I first saw you for this, is it like where it was at in the same sort of symptoms and everything, but now it's a little bit more irritable?
Yes.
Okay. Any new symptoms?
No.
Okay. And any extended any extended periods of time where you were lifting a bunch of stuff or picking up heavy stuff?
I don't know what you call heavy. I did, yeah.
Anything out of the norm?
Yeah. My crock pot's pretty heavy, and I bent down to get it out of the cabinet and lifted it up.
Yeah. Did that start some of that pain, or was it like, I just know I did that today? It wasn't one of those instances where you picked it up and
it didn't. It didn't instantly hurt. No.
Okay. Just checking. All right, cool. It might be something where you need to take a day or two off to let stuff calm down a bit, especially if stuff's flared up. That's what I usually suggest. But we'll just see if it's even slightly able to change. If not, I'd say we take a day off before doing another checkup, maybe tomorrow or Saturday.
Okay.
All right. So let's see. While you're just sitting there, can you kick out your right foot, the one that's not bothering you, the right side? Kick out the foot and then bring your toe back towards your head.
Okay.
And then put that one down and then compare it with the other side.
Okay.
Yeah, I don't need to see it. It's okay.
Okay. Well, when I straighten the left one up, it pulls in that hip area.
Okay.
It hurts.
Gotcha. All right.
Yep.
In the back specifically, or in the hip too, or both?
Actually, no, it was felt like it was more in the hip. It's kind of hard, it's all coming out there.
Yeah, it's all ticked off right now. Yep.
Yeah.
Okay. And then let's have you stand and kind of do the forward bending, toe touch, and all that stuff.
Okay. Okay.
Your side.
Okay. Now, You
So
want me to bend forward?
Yep. And then what are you feeling whenever you're reaching down towards your toes there?
It really, not much. That doesn't really hurt it.
That doesn't irritate it more?
No.
Okay. And then if you come on back
And
up.
I can feel it a little bit in there, but it doesn't hurt like it did when I lifted it up a minute ago.
Gotcha.
Okay.
And then hands on the back of your hips and lean backwards there. What happens with that one?
Well, again, I can feel it right in this area here.
Mm-hmm. Yep.
But
does it increase and then come back to normal, or does it just, it's the same number whether you're bending backwards or upright?
Oh, it might be a little bit worse. Yeah.
Okay. Where is it worse?
Right in this area.
In that area. Okay. Gotcha. And then if you put your hands on the hips and kind of slide.
All right. If I go to this side. No.
Which is this side? I can't really tell.
Okay. When I go to the right.
Yep.
Nothing. When I go to the left, yes, that's when it hurts.
Where does that get you?
Right in
the glute or the hip?
The sacrum.
The sacrum, the glute, whatever.
Okay, gotcha. All right. So here's what we'll do. Sit down on the couch there. Let's see.
The lumbar. That's the lumbar region.
Sure. Yep.
It's a little lower. Yeah, it's right.
Yeah.
There.
It's that spot that you have. We'll just call it your spot.
Up here.
Yeah, that's not what hurts. This is what hurts.
Yeah. So here's what I want you to do. I'm going to show you a little movement here. So what you're going to do is you're going to sit here and you're going to slouch and then come back up and then slouch and come back up. And I want you to do like 10 of those just to neutral. You don't have to go way up. But no. Here, watch. All I want you to do is slouch and then just come back up to neutral. I don't want you to go back.
Okay.
Yeah. So it's just slouch and then just come back up to neutral.
Neutral.
Yep.
Slouch. Neutral.
Good. Let's do about 10 of those.
3.
So you're kind of slouching and then right back up.
4.
Does that hurt you at all when you're doing it?
I could feel it, but it's not killing me.
Okay. Where do you feel it at?
Right back in my sacrum area.
Okay. Center, left, or right?
Left.
Left? Okay. So slouch and then right back up to neutral. Slouch. There you go. And then really slouch. And then there you go. Does that hurt when you're slouching or when you're back up?
Does it hurt when you're slouching or back up?
It pulls when I'm down,
Mm-hmm.
but I really wouldn't say, maybe my pain threshold is too high. I'm not going to say that it hurts. That's
right.
Not the worst.
Yeah.
So it's more uncomfortable when you slouch than it is when you sit.
Yes, but it's not bad. It's not like when I'm bending to the left. That really grabbed.
Yeah.
But doing this is not that much.
Okay. All right.
Uncomfortable.
Yeah. So it's not like it goes from a 4 to an 8 when you slouch.
No.
Okay.
No.
All right. Let's see.
It's sensitive.
Am I being difficult?
No, not at all. I know what it is. I'm just trying to make sure that there's nothing to resolve this faster. As you can probably tell, like your symptoms are kind of anything that closes down on the space, ticks it off and makes it radiate a little bit out to the side and the buttock. Right. So it's kind of, whereas last time, whenever you would do something, it would kind of more or less just be in the back area and not as bad in the hip unless we stretched to the opposite side. But today, flexion didn't make you any worse, whereas last time that would increase your buttock pain. And then side glide to the right, away from the pain, would increase your pain there last time too. But now it's all flipped. So it's all the opposite. So if something's flared up, think about it this way. If you smash your thumb with a hammer and that thumb swells up, there's nothing you can really do to speed it up other than a little bit of ice and some time. Make sense? So it kind of calms back down and decreases that inflammation. So if something about the elliptical, that maybe when you're doing this sort of motion was kind of, I don't know, and I'm just completely speculating. I didn't see what you were doing. I don't know, but I know how an elliptical goes back and forth, and it might have just kind of done this to your spine versus your exercise is anterior and posterior, back and forth, versus on the elliptical, you kind of get this torque twist motion,
Right.
which can kind of twist and kind of tick off the nerves that are already a little bit predisposed to being angry again. So that might have been the case. Who knows? But if you have an active inflammation, all you need to do is give it a little bit of time and give it a little bit of joint flushing, joint mobilizations, like easy self-mobilizations to flush that inflammation, not out, but it'll give it the stuff to make it resolve as fast as possible, because it's still a time-dependent thing. Think of that spot in your back as a flu, literally, and you might have to give it 24 hours for that flu to kind of resolve.
Okay.
So,
what number of elevation was that elliptical on?
Well, it was on 5 when I started, but I knocked it down to 3 or 2, I think.
Because you can go to nothing.
Well, I didn't think I'd be exercising if I went all the way down.
Well, but you see the walking and the elliptical is you were lifting your knees a little higher.
Yeah, that's a good point, because the elliptical is elevated.
Yeah.
Whereas when I'm walking, it's
you're flat. Yeah.
There's a little bit of hill once in a while, but it's basically flat.
Yeah. Right.
So that is definitely different than taking a walk.
And like, it might have, how long ago has it been since you've done the elliptical? Honestly, is it years?
No, months.
Months? Have you been able to do it?
I tried it when I first got off of physical therapy.
Mm-hmm.
And
home health, after your home health was done?
The home health physical therapy. They quit coming. They, both the PT and the doctor said I could try it.
Mm-hmm.
Don't irritate anything. If it bothers me, don't do it. And so I tried to do it for like 5 minutes, and it was really hard. It didn't work well for me.
Yeah.
And I tried it for 2 or 3 days, and so I quit. So today I thought, okay, I need some exercise. I need to do something.
I should have told you don't do anything new. Yeah. Usually that's the number one thing is people, when they start feeling good, they're like, oh yeah, I'm totally going to do something new. Like the most common thing is people will clean their whole house when they haven't done it in years. And it's like, what are you doing? No, don't clean the whole house. You're just starting to feel better. Yes, I know. But similarly, you saw an exercise that usually wipes you out in 5 minutes and went, oh yeah, I totally got this, and did 10 minutes with, level 5 down to 2, luckily. But still, you're feeling good. That's what at least lets me know that your brain was in a mode of, I feel pretty good today. I could maybe do this. If you're feeling like crap, the last thing you want to do is something that in the back of your mind previously when you attempted it made you feel like crap. You know what I mean? So, and you were on a slow little incline of improvement, and then you just hit a snag. So it's not going to be a forever thing, but I would suggest that we do probably 1 or 2 more rounds of the slouch correct, and then we'll just check your nerve tension and your movement real easy, just 1 more time. And then I'm going to have you hold off of the back bends for a couple of days and just do the slouch correct. Because I don't want you to keep hammering away at something that's not going to fix it. So real specific, let me show you. Let me move this mic a little bit. So when you're sitting here, you're going to slouch. Literally hands on your knees is the best place to do it. And then you're going to almost pull yourself to neutral again, and then slouch, and then just pull yourself back up to neutral.
Am I doing what he's doing?
Ish, kind of.
Yeah, can you?
So you should feel a round in your back when you slouch. And then when you come back up, it should be just like you're sitting up a tiny bit.
So it's kind of like you're
just bringing your shoulder forward.
You're doing a gear.
You're slouching as bad as you can, honestly.
Okay.
Yeah. So slouch as bad as you can. And don't even worry about the shoulders. It's just rounding your low back. like you're trying to round your low back, and then just back up to neutral. So not even forward bending. See how you're doing this? Here, watch me for a second. You're kind of going like this.
Right.
I don't want forward. I'd rather you just go and slouch. It's almost like if somebody's trying to punch you in the stomach and you're trying to dodge it.
So just
collapse. Exactly. Collapse and then back up. Collapse and then back up. Yep. And all we're doing is we're taking your spine and we're opening up a little bit and then taking it to neutral. We're just flushing it back and forth like this. There you go. Yep. Is that bugging you anywhere? Increasing anything?
My back's getting a little tired.
Okay, good. Then you're doing it right. Because those muscles that are back there are the things that are lifting you back up. Okay, good. And let's just check your nerve tension now. So just kind of kick out that left leg, straighten the left leg out, and then bring your toe back towards your head. Is that any worse than last time?
No, it still hurts some, but it's not worse.
Okay, just checking. That's the only thing I want you to do, okay?
Okay, so how many times a day do you want me to slouch?
I'd say every hour, every couple of hours. Do not set an alarm tonight. Don't set an alarm for every hour tonight. I know you wouldn't.
It is.
You'll crash on the couch any minute.
No, when I wake up in the morning.
Yeah. It should get better in the morning. Here's the thing. If it's the back problem that's returned again, your morning, if that's the case, your morning tomorrow morning is going to be crappy. Like you're going to be real stiff and achy and not be able to move as well. If it's just inflammation, it'll probably be a bit better when you wake up in the morning and your motion won't be blocked or anything. Like today, your motion's not blocked. It's just flared up.
Okay.
That makes sense? Or am I putting words in your mouth? Is your motion like massively decreased to where you can't move around as well?
Not massively decreased, no.
Okay.
I'm not, like I said, I don't feel as good today or this evening as I have been feeling. And I'm kind of fatigued too.
Yeah.
And the
tired.
weather changed.
Yeah. Has the right hip bugging you with the weather shift? No, that's good.
There's no, once in a while in the part close to my knee, I get a little something, but the hip area, nothing ever.
That's amazing. Yeah.
Yeah.
That's 3D printing. They fit that sucker right into your bone. That's great.
They did that.
Yeah. Oh boy. Okay. Yeah. No need to flare anything else up. So, summary: do not do any more of the back bends. Hold off on those. Okay. Those exercises you were doing, hold off on those for a couple of days until I talk to you over the weekend. We'll text back and forth. And then just the slouch correct. And remember, it's not forward bending and up. It's just
slouching.
Yep. Just slouch. Pretend like somebody's trying to punch you in the stomach and you're trying to dodge it, and then come back up to neutral. Just back and forth. And you should feel some of that fatigue like in your back muscles back here because you're making them work.
Yeah.
Mm-hmm. Is it both sides or just one side that you feel that? Okay, perfect. That's exactly what should happen. So as long as that's the case, just 6 times a day, just 10 or 15 repetitions of them. And as long as you do not get worse, if you want to check if you're worse or not, try your nerve tension before you do some of the slouch correct, and then try them after. It should be the same or less.
Okay.
Okay.
If it's more, then I shouldn't be doing it.
Yeah, just hold off and shoot me a text. But it's going to be pretty darn rare that if you just do slouch correct, it worsens your nerve tension. It's just a flushing movement. It's not a movement to try and get you to end range or do anything else. It's just kind of helping to flush.
Okay.
And then whatever you would do for a headache, is you were saying Aleve or something like that, huh?
Yeah, Advil. I can't take Advil because it gives me a headache.
Yeah.
And if I take Advil, then I have to take something for the headache. So
yeah. That's what, if it was me with this situation, I'd take something that would usually make some sort of headachy type of stuff or body ache decrease. That's what I would do.
Well, and Aleve works for me. That's
Mhm.
that's my go-to medicine for headaches and things. It works
Yep.
better. Tylenol will work, but I have to take more of it. It's not as effective for me.
Yeah. But try this for a couple days. Tomorrow, let me know how it is in the morning. I'll set up a text actually to auto send to you. That's what I did 3 days ago. Is I sent that text that came to you saying you want to set up something. I set that up 3 days ago after I saw you, so that it would just get to you,
cool.
and then I could basically respond to you responding to me.
Oh,
So
okay. Well,
I'll set up something to shoot you a message tomorrow morning to let me know how your morning was.
See
and
how
stuff.
I am when I wake up.
Yeah.
So should I not go for a walk in the morning?
As long as you're not worse, go for a walk. I think it'll be okay. If you might cut it down to like, if you wake up and you're like, ugh, I'm horrible, don't go for a walk.
Right.
Like, treat it just like you have the flu, but it's in your back. Like, if you had the flu, the last thing you would do is go for a walk. So remember, it's not an exercise thing that's going to solve this. It's a time thing to let that inflammation decrease and go away.
Okay.
Good. So no standing extensions. None of those. Hold off on those. Okay. Any more questions?
Nope.
No? Okay.